Hello, welcome. Welcome, everyone. Hi, Janet. Hi, Nicole. Hey, Pam. Good morning, Amber.
Hola, my friend.
Hola, friend. Hi, Grace. Hello, O'Brien. So nice to see everyone today. Hi, Britton. Welcome, welcome. We have a really incredible kickoff to our community highlights series this year. And we're going to jump right in about 1 minute. We're expecting a couple more to join. So I want to give them a little bit of time to jump on. In the meantime, if you would like to add your name, location, organization into the chat, so you can just see where we are at in the state of Illinois today. Hopefully all good weather. Morning, Ashley. Hi, Jasmine. Hey, Jennifer. Wonderful. I'm going to give us just about 30 seconds more and then jump right in. Name, organization, location in the chat. Great. Thank you all. Thanks, Amber. Yes, tomorrow is my birthday. I'm turning 21. Everyone believes it, right? Great. All right. Um, Let's jump right into this. Thank you all for joining us for our Lunch and Learn series, the Community Collaborations in Action. This is a series that we kicked off last year that we host about 3 to 4 collaborations each year, just highlighting the incredible work that's happening in our state. Today, we are highlighting the Sauk Valley Stars and their partnership with our Birth to 5 Illinois partners from Region 47. We have 4 panelists today, and before we get into our panel, we're going to hear a little bit about the incredible work that's happening in this collaboration. I would like to start by just introducing our guests. We have on right up first, and when I say your name, just an old-fashioned wave on the screen so everyone can see you. Lois Mesenheimer. Lois is the chair of the Sauk Valley Stars Early Childhood Coalition, which partners with the Birth to 5 Illinois Region 47 to provide joint regional meetings for coalition partners and Birth to 5 Illinois Advisory Council members. Lois works for the Regional Office of Education number 47, and this is her 25th year. Congratulations, Lois. That's amazing. And the ROE is the fiscal agent for the STARS Coalition's Birth to 5 Illinois subcontract. Lois coordinates the ROE's Parents as Teachers program for Lee, O.W.L, and Whiteside County area. Welcome, Lois. We also have Abby Hoskins. Abby is the Regional Council Manager for the Birth to 5 Illinois Region 47 that serves Lee, O.W.L, and Whiteside counties. She's dedicated to supporting families, providers, and communities to strengthen opportunities for young children. And for the past 3 years, Abby has supported the Regional 47 Action Council and partnered with Sauk Valley Stars to build strong connections across their communities. Joining Region 47, we have our Stephanie King, and Stephanie King is the Regional Family and Community Engagement Specialist with Birth to 5 Illinois. Stephanie has worked for Birth to 5 Illinois for 3 years as well, and her primary job is to engage with families and the community. She works closely with the Birth to 5 Illinois Region 47 Family Council. And with the team today is Allison Vrana, who's been with Birth to 5 Illinois for 2 years. Originally, she was on the Action Council, then moved over to the Family Council. She's a mom of 2 toddlers, a 2-year-old boy and a 4-year-old girl, and she's also the assistant principal for Rochelle High School. She's been an educator for 14 years. Thank you all for joining us today. Hi. So the way we like to do this is we're going to hear a little bit about the incredible collaboration work that's happening between the Sauk Valley Stars and Region 47. They're going to give us a little overview, and we are going to get a little walkthrough of their site, O.W.L. But then we have some questions. But since we have a pretty great group here, as questions come along, please feel free to add them to the chat. We are monitoring the chat as they come along, and we can definitely ask questions during while we're in the moment. And remember, we're going to save some time for additional questions at the end. So I hope you have your pen and paper near you. Do people use that anymore? Or digital pen and paper for all these wonderful questions. So I'm going to just turn it over to you, Lois and Abby, to begin to share an overview and intro to your work.
Good morning. Thanks for having us. As mentioned, I'm Lois with the STARS Coalition. We have been around since, I feel like, the dawn of time, probably as long as I've been at the office, so 25 years. We've had an early childhood coalition. Our regional superintendent at that time was hearing, discussion at the state level about the need for one. And so he got all of the school districts in the county together and formed a coalition, early childhood coalition. And then as we merged with, that was Whiteside. And when we merged with Lee and O.W.L, then we expanded to include all of the school districts and early childhood providers and supportive services in the 3-county area. So about COVID time, we were approached by the governor's office and Illinois Action for Children to talk about, did we want to do some community collaboration work, get Iris in our communities? And so that was really the launch of all of the work that's happening right now. So we have been talking and kind of working on how we can collaborate better with our partners in the region since then. And one of the things that's always kind of been on the burner is how we can disseminate information about early childhood programs to community members. So we've gone through a variety of ways of doing that. Currently on the ROE website, there is an overview of the coalition and some just basic early childhood information. But through our partnership 3 years ago with Birth of 5 Illinois, we, as it was being formed, were one of the early MOUs that was established with the region. And so we, from the beginning, have been like a giant, large part of the Action Council. And so we structure our region a little bit differently than other regions just because of our MOU. And I can let Abby talk more about that because that's, I feel like she's more knowledgeable on all of that back end Action Council stuff. But the STARS Coalition has a big voice in what's happening in regional council work. And with the addition of the regional council and the family council, or the Action Council and the family council, we have now paid staff who can do some supportive services that we were just trying to do as volunteers. Because no one on our coalition is paid. We are all volunteer people. So I will turn it over to Abby and let her then talk about some of the things that they're able to provide as part of their work with the Action Council. Is that a good description there? Yep.
Wonderful. Thanks, Lois. As Jacqueline said, I'm with Birth to 5 Illinois Region 47, which is Lee, O.W.L, and Whiteside counties. And as Lois mentioned, we're really happy to partner with the Sauk Valley Stars Early Childhood Coalition. So Birth to 5 Illinois works in every community in the state to find out what families are not able to access early childhood services, and then be able to tell decision makers about early childhood services that local families and children say they need to thrive. So there are 39 regions throughout the state that follow the same boundaries as the regional offices of education. But for us specifically looking at Region 47, we cover Lee, Ogle, and Whiteside counties. So in the kind of the northwestern corner of Illinois. Our role at the regional level is to listen to families, work with community leaders, and elevate local needs so that the state level systems can better support children birth to age 5. We achieve this, as Lois started to talk about, by working with the community through our Action and our Family Council. So the Action Council is made up of community leaders from different sectors working in the 3 counties. And then our Family Council is made up of parents and caregivers who live in the region and are raising children 8 and under. So as Jacqueline introduced Allison a couple minutes ago, we're really excited to have her with us because that family voice is so important as we're looking to see what community needs and then how do we work as a community to improve those things. And then we partner with the Sauk Valley Stars Early Childhood Coalition. So that is another really great thing about our region, a very strong region on collaboration and working together, and having that partnership with Sauk Valley Stars has allowed us to just really grow the voices included at the table, making sure that we have different vantage points, having that cross-sector representation. So both the Stars and the Action Council not only have folks from the early childhood world, but also people at the table that might not have traditionally been there, like the chambers of commerce and the business community, mental health, healthcare, the faith community, and then also tying in that family voice from the family council. So over the last 3 years, we've really looked at how do we continue that work and that momentum and making sure that we're meeting the needs of our community. And that's what we're here to talk about today is the O.W.L Early Childhood Resource Hub. So I am going to share my screen. Bear with me for a moment. Right. So we thought it would be great before we dive into the panel just to kind of walk everyone through kind of where we started and how we got to O.W.L, and then actually show you the O.W.L site, which we're really excited about. So as Lois mentioned, we've partnered with the Action Family Council and Sauk Valley Stars over the last 3 years. And in 2023, we completed an early childhood regional needs assessment. And during that assessment, we looked at the great strengths that we have in our region, but also the needs that we had. So looking at our needs, one of the things that was brought up by both the community leaders and the parents was general awareness, as Lois talked about, and making sure that we had things that families wanted when it came to early childhood and making sure they are aware of all the great resources that we had. So the Action and the Family Council and the STARS Coalition worked together to develop SMART goals to address this. So through those recommendations, one of the goals that the community came up with was to work to create an inclusive, comprehensive early childhood resource hub for parents and caregivers that was recognizable and provided a wide range of early childhood services. We heard things from parents that they were kind of over the pamphlets that they saw in the doctor's office, or they hadn't seen things. We needed things digital in front of us. Sometimes it was overwhelming to find all of the resources, and having it all in one spot and breaking it down in simple terms and convenient for parents was something that they were really desiring. So over the course of the next year of creating the SMART goal, the councils and the STARS group worked together to really look at what did that mean? How do we do this? How do we achieve this? And making sure that it was something that really was there for families and supporting them, and then also something that family our early childhood providers could use as well. And then so along with the STARS group and the councils, we spent time really looking at, okay, how do we achieve that? We had conversations about a website's great, but it's a full-time job, or the cost that goes into that. What's going to make this a little bit different than all the other websites and things like that. So the Family Council really led the charge with sharing their ideas and really having that voice of what do we want as parents and caregivers in our community. And then the Action Council and the STARS group were able to take those notes and that feedback and work together with them to design this. So we talked about different categories of making sure that it was inclusive to family events. They talked about early childhood health, development, resources, childcare, early childhood education. They also then started to compartmentalize, okay, well, what isn't a community event? What types of things do we need for that? Obviously, wanting it family friendly, resource fairs, health topics, along with child development. We also had really great conversations that we heard from both the community leaders and from the family council of we need to also make sure this is relatable. Some of those terms, like a screening, might be something that might turn away a parent if they think it's something negative. So how do we talk about that? How do we bring up early intervention and topics like that so that way families kind of understand what it is? And if they're not quite ready to dive into that, then there's other topics in there that maybe we can kind of build those trust levels and supports as well. So the councils went through a lot of brainstorming and working to just ensure all components were in this resource hub, which brought us to the OWL Early Childhood Resource Hub. The councils landed on a bit.ly page because as I talked about, a website is expensive and a full-time job. And our council members had the great idea of ensuring that we know things change in early childhood, sometimes fast, sometimes slow. But as long as we keep this bit.ly link the same, then parents know where to come and can rely on that. So essentially, the OWL bit.ly link is something that we can use in newsletters. We can use it on Facebook and make sure it's kind of a landing page for families. OWL stands for O.W.L, Whiteside, and Lee. That was brainstormed by the Family Council, so the parents on the Family Council, as a kind of cute visual. When you see it, hopefully you think early childhood, not another textbook, but something that we could kind of start really using that phrase in our community. And then it really tied in well with the stars of having the owl with the stars in the background in our local early childhood collaboration. So we had some wonderful ideas from people in our community. And on the bit.ly link, the idea is that it's simple. It can open on a phone, it can open on a computer, but they're going to come to this landing page and they're going to have in front of them the actual early childhood resource hub, which I'll show you in a moment, the early childhood Facebook page for OWL, which just is kind of further networking and sharing in our community, live up-to-date things and events as well. They can interact. The Region 47 Childcare Toolkit, which is part of the OWL Toolkit and another part of our action plan of connecting with the business community and providing them with childcare resources. And then the Sauk Valley Stars Coalition has many great resources and have a pamphlet on careers in early childhood, and then an early childhood guidebook as well, which is all linked in here. And as you'll see at some point, the link for this, we definitely encourage everyone to take a look through it. But just real quick, I wanted to show everyone the OWL Early Childhood Resource Hub. This is still a work in progress. We believe in continuous quality improvement. So as we've launched this just launched in the beginning of May, so it is fairly new for our communities. We are still learning. We knew when we did this that we would probably learn different things we needed, maybe different ways to present it, and getting it out there and talking with families and providers in the community. We've already learned two things right off the bat: that this needs to be translated into Spanish, so that is currently in progress. And we also learned that it would be wonderful to have a community and family learning page. So we heard from parents, parent education topics were a desire. And then from our early childhood providers, this would be a really nice spot to centralize some of those training calendars and events and things like that too. So those are some things in the progress. But here's where it currently stands today. Parents can click navigation. So if they need to take a look at different topics and they want to skip ahead, they can. Or if they want to just scroll through the entire page, they can as well. But the idea was that this was not reinventing the wheel. This page is all the awesome resources that already existed in our community, bringing them to one convenient spot, but then also putting in some small explanations to parents that are simple, easy to read, and having the feedback from STARS and the Action Council, and most importantly, the parents on the Family Council. We were able to really break down that language and hopefully have it in simplified terms for families. The owl is supposed to be a little resource as you go along. You can click on them. So if you see the little hand, you know it's clickable. And the first thing off the bat, our councils and STARS talked about is this is wonderful, but some families still need someone in person. So on every page, the community is going to see the little owl and be directed that they can click the owl at any time and be connected with the regional coordinated intake. So that was something really important. The Regional Office of Education, number 47, has a coordinated intake specialist. When they click the owl, it immediately brings it to them. So if that family is just ready and says, hey, I'd like to talk to someone, they have immediate access to the resource directory and the ability to put in their information and be connected with that person to walk them through. So whether that happens right at the beginning or if it happens after they've read everything and maybe they're feeling overwhelmed, the community felt very strongly of making sure we had someone to support them through that. So you'll see the owl on every page. Families and the community can come in, they can find early childhood events. So they can easily click and interact in here. So we've got up-to-date spreadsheets for everyone, breaking down like the date, the type of event, the time, where it's at, all the way down to flyers and things like that in one spot, along with just kind of recurring events such as library events. We're still building support groups, so that's part of that continuous quality improvement. And then also highlighting a lot of our really great regional training calendars. So these are still kind of works in progress for us at this time. We are still adding to the support group and the community training calendars. And then as they go along, they can first and foremost learn about what is early childhood and why is it important. We want to support their child's development. So putting in here kind of the who in our region does what and playing on that little owl pun of making sure they have all those resources. And then highlighting the great programs that we have. So like I said, this is going to link to programs, websites already existing. So we're breaking down in a convenient spot the different types of programs, where they might be located, and then they can just click. So if they want more information on Baby Talk, they click it and it brings it to the website. Or the Parents as Teachers program, it clicks it and it brings them straight to that website, along with some 3 to 5 programming, such as Head Start and our Preschool for All programs. We wanted to make sure families had information on what a developmental screening was and how it could support their child. We're fortunate to have ongoing screenings at the ROE, the Regional Office of Education, here in our region, so they can click the owl again and get scheduled for that. And then the screenings that come up throughout the year, we're sharing through Facebook or through that event page that I showed you all. Information on early intervention and explaining to families. We have 2 different child and family connections in our region. So if they live in O.W.L County, they would go to one, and the other 2 counties would go to another, which was something that could be confusing to parents. And then also breaking down childcare. So as I talked about, there is a childcare toolkit that the region collaborated on as well, but then connecting them with 4C, our local childcare resource and referral agency, along with Illinois Cares for Kids website, so they have resources on that. And then we have a really great resource guide in our community as well, through the STARS Coalition and the Regional Office of Education. So the councils and the STARS group said we also need to provide families with the resources of getting there or sustaining it and stressors in their lives. So all of these will link to that resource guide with different topics that might help their family, along with staying connected. So through that OWL Facebook page that I talked about, and 2 of our community newsletters that will keep them up to date on early childhood happenings and progress like work like this. And then one of the neatest things, in my opinion, is this last page. So it was made possible through that collaboration and kind of why we're here today, talking about how we collaborate in Region 47. And this last slide, we all think is just really beautiful to see the Family Council, the STARS Coalition, us, but then all those other entities that came together to make this possible. So families can click on here and get directed to those websites. But I think it's also important that our region found it important to show collaboration in our region. And also recognizing that, hey, they might not know Abby at Birth to Five, Illinois, but if they've built that relationship with Cinesippy centers through a counselor, or maybe their child goes to Sterling Rock Falls Childcare Center, those things stand out to families of this is a legitimate site. This is someone I trust. This person can connect me. So it just kind of talks about how we strengthen those relationships and kind of continually sharing our voices and connecting with people in our region. So that is the O.W.L site. I will hand it back over to Jacqueline.
What a wonderful, wonderful site. Thank you for sharing this. We have a couple follow-up questions in the chat, so I'm going to go to those first, and then we have a panel. And, anyone can feel free to jump off and ask questions here too. I see Janet asked a great question here about who maintains and updates the website information. So those spreadsheets that you were showing is when she entered that question.
Yeah, I can kick that off. Because we have this great partnership, we get together very regularly in our region. So the Action Council, Family Council, and the STARS Coalition work to do that together. So it is a community lift. We are able to connect them. So Lois and I work very closely as a team to have those ongoing conversations, but we have ultimately set up Google Forms. We're still in the process. It is a learning curve of making sure people are submitting things, but conveniently, if they're submitting through that form, they're giving us all of those events. So compiling the flyers, compiling the dates and the links and things like that. And then we're fortunate with the STARS collaboration and our team in Region 47 to then be able to load those things up. And we have really great shared procedures as well of making sure that anyone within the councils or the collaboration have those if they need to. So if there ever was turnover and things like that, we talked about that as councils of making sure we have everything kind of written, all the passwords saved, how to do this. So just like we wanted the O.W.L site to be simple, this should continue to be a community lift. So we are supporting the councils and the community in doing this. And then hopefully as we continue to work and remind, it'll sustain itself with people uploading those things themselves.
Thank you for your transparency in that. A lot of initiatives, especially when we get started, recognizing that, we're learning and we're growing. And I know that you have identified a few things here, but that intention and thought that goes into it is wonderful. Thank you for sharing that. I do see Amber also had a question here so are you using Bitly for families to get to O.W.L, but it is managed through Canva? Or
So
Amber, did you? Oh, go
the
ahead.
site itself was built in Canva. Our councils and the STARS Coalition talked a lot about many platforms. Google sites were brought up. There was the talk of a paid website and things like that. And we know that continuous quality improvement cycle, we might have to revisit this in the future. But Canva was a free resource for us to use that was fairly easy to do. And we were able to just through council meetings and STARS meetings, plan out the look, the feel, and things like that through Canva. So the Canva site is what I just scrolled through, but that's linked in Bitly. And Bitly, as you put in the chat, is nice because you can see the data of who's clicking it and who's interacting in it. So it's been really fun to watch that. But the idea was that Bitly can sustain all those things. So That's not our goal, but if the Canvas site didn't work out, and we needed a different site or something else, that bit.ly stayed the same. It could stay the same for everyone else. The Facebook can be linked to that. Those awesome guides that the Stars Coalition have can all be linked to that. So bit.ly is our landing page, but having that site to go through, kind of a virtual pamphlet. So similar to a website, but a little bit different than a website. It's much easier to navigate, and our councils have worked to show us that it's very easy to do, is on there. So hopefully that answers Amber's question.
Thank you.
And on the back end, we had a discussion about who who's the owner of that, because we are all volunteer. it and the ROE is the fiscal agent. It seemed logical that the ROE would host all of these things. So through our ROE accounts, we are hosting the spreadsheets. The Facebook page runs through, I'm like unclear now. It's all kind of through the ROE stuff on the back end, because we figure the ROE is probably not ever going away. So that is kind of the stability piece in the background. And because we're education, we can access things like the Canvas site for free, and that is a benefit as well.
Those are great
And
points, Lois. Thank you.
anything to clarify, Abby, on that end?
No, I think you summed it. The idea was this is a community lift. So the ROE is part of that community, bringing it together. Bertha 5 Illinois Region 47 and Sauk Valley Stars work to coordinate it all together, but then it's there for the community to maintain, and we will support it as collaborations and councils.
And I think the other thing to note is also on there is that everything like on that bit.ly, on the Canva like slides, it's all connected to resources that are already there. So it's really up to these other agencies to keep their stuff updated, and our stuff is it's very basic. Just kind of gives that little overview of what is there. So it doesn't really take, for that doesn't take a whole lot on us to keep anything updated. Just if a program went away or if another program comes in, then we would want to add that. But everything is just connected to those websites that are already there.
I love that, Stephanie. And from the perspective of a parent, having to navigate multiple sites and figuring it out, it takes that guesswork out and you have it all right there. Wonderful. And I think on the same thread of in talking about the bit.ly and navigation, have you observed any usage patterns since you were talking about how you can grab that data? Have you seen any usage patterns or heard feedback maybe that highlights how the hub has made a difference in maybe some families or provider outreach? I know it's still relatively new, but any like anecdotes that you've heard of yet?
Yeah, I think we're still in that learning curve phase for sure. It's been fun to watch the data and see numbers, but I think the best data we're getting is that qualitative data that we're getting out in the community. So this is being shared by different organizations as they go out to events. We get to gather as collaboration and councils and talk. So whether it's the family council like Allison, bringing back feedback as she shared it as a community member, to Lois being in a leadership meeting and talking about it. We're hearing the feedback through that, along with just general families at events. And then we're learning that the Facebook data is actually one we can really see of like who's local a little bit more, because with bit.ly we do get numbers and you can see that sometimes different domains come from different areas and things like that. So you can't necessarily track it down. And I think this was a question in the chat as well. It is the free bit.ly. So they're probably, if people wanted more of that data that way, could dive in a little bit more deeper if they wanted to. But just since May, we're over 225 Facebook followers, which for our 3 rural small counties, that's growing pretty fast. And we're seeing interactions and that web of this childcare shared it, and then we see families gather and we see different articles where the different organizations are being spotlighted as well. So I don't know, Allison, if you have anything you think can think of as far as just feedback from families from your lens.
Yeah, I mean, I think right now we're now that it's launched, that we're kind of learning where we can share it out to. Right now, we've been a little bit limited in just the families and the moms that we have on our family council. And so some of us have a lot of connections in certain areas. Like, for example, I have a lot of connections in Rochelle, but then trying to get those connections to then share and post is another layer to it, because you're not the one doing it anymore. So I know I've shared it out. I work at a school, so I can share it out to the school. I've shared it with our other district, and then I've shared it with our early childhood center. And I think it just is the word of mouth and continuing to share it on Facebook and sending out the links via email and just reminding people that it's still there. As far as like anecdotes from this helping parents, I haven't heard any yet, but we're kind of in the group, so it's a little harder when we kind of put it together. I'd be interested to hear from the healthcare providers, and I think that's part of our next goal, that we're working on, that outreach to healthcare and providers and mental health and all of that. So that's kind of our next steps, I think.
Those are great next steps. Allison, while I have you off mute there, and Stephanie, can you speak a little bit more to the role of families and caregivers in that co-creation and in guiding the hub's content and design, being a part of it and what that lift looked like?
Yeah, I can talk about that. I think, well, childcare is well, everything is ever changing, right? And it's cyclical. But I think since COVID, there's really been a crash in childcare providers, and a significant need coming out of COVID. And I think that's obviously where this arose. And then just talking to the families about what they went through during COVID and are still going through post-COVID has really been important, because we're the ones kind of living it. Even though my kids are slightly older now, 2 and 4, and in preschool, that only takes care of half the day. And I think schools and providers understand some of the things that parents are going through to get kids taken care of and getting them what they need and the supports they need. But I think it helps to put all of this down on paper, so that when we're sharing out these resources to providers, you're really hearing all of the things that parents are struggling with. And it can be more of, like Abby said, a community lift, trying to get parents the support they need. And I've always said, if I'm struggling, both my husband and I have solid jobs. We're both educated. Um, we don't struggle financially. We have all the resources afforded to us, and we are struggling. So what does that mean for a large part of our community who don't have access to those resources? So that's why I think the family council is really important, just getting everybody's voices heard and hearing the different issues that different families go through.
Yeah, and I agree. Our family council, was a huge part in it. Everybody has their own experiences, throughout our family council. Everybody's, we have a great wide range of parents on there, from all over all 3 counties. And like I said, they all have their own experiences, and brought different things to the table. So with what needed to be included, and what needed to be shared on there.
Thank you. And that, just really thinking about all 3 counties, that's a wide, net to cast to make sure you're having all those voices. So I think that's so wonderful that you are really thinking about how to get to each of those areas. Um, one thing that I think every conversation we need to talk about barriers, and hurdles, just so that, and for those that are here listening today, what were some barriers or some of the biggest barriers that you may have faced, technical, outreach related, or otherwise when building and launching this hub? Um, and this can really be open to anyone who would like to share.
I think the biggest barrier is not giving up and making sure we connect with the community. So I think just seeing some of those questions initially in the chat of who's running it, how did you do it, that those were our barriers. We went to that drawing board, and it was very important to us that we included, and I think Lois can agree with this, our our stars and our action council, but the family council as well. So when you talk to parents, you really hear that raw feedback of, this hasn't worked for me. Just like Allison said, if I'm struggling, everyone is struggling probably alongside me. And parents had big ideas and they really held us accountable. I remember debriefing with Stephanie at the end of the meeting of, wow, they have great ideas. How are we going to do this? And then we have that unique ability in our region to then tie in the Action Council and the STARS Coalition. And it took work, to say to them, hey, this is what they want. And you kind of have those negative thoughts at first of the costs, the maintaining, we're not tech experts. But we have some really great rock stars in our region. I know Grace is on the call with us right now, who had that insight of being able to say, well, did you think of a bit.ly link? Did you think of this? And our community didn't give up. So I think that was one of those initial things of, yes, we can't go sign a contract on a big website, but how do we make this work in a way that it truly can be a community lift? And so having those partners at the table, like Grace and all the different folks you saw at the end of the O.W.L site, we were able to brainstorm and we kept that conversation going back and forth. It still isn't easy, like we talked about. You have to kind of reinvent the wheel, and we've gotten feedback that we have to go back to the drawing board. But I think Lois can probably agree that if we keep going back to the drawing board, that means we're meeting our community's needs. So I think the biggest barriers were the semantics, but then we had to just really kind of like those bubble charts I showed, really keep tying it back of how do we achieve this? And if this doesn't work, what is our next step? So we're still definitely in that, flying it phase, and seeing how it flies. But our community continues to come together, and both the stars and the action and the family council, every meeting we have, they found another resource or another great idea. And so I think really collaboration is the key to that, because if you keep working together, you'll find something that really works for your community. Lois, is there anything else you can think of?
Well, I just think too, Abby would come back and say, like, they're so excited. The parents are so excited. They're designing T-shirts and like, so they really bought into it, the O.W.L stuff. And like, okay, great. But they like to do more of the work. And we also had to think about logistic. So just like thinking about the like the Facebook content. We really wanted to have parents super involved, but we also knew as it's representing our 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 coalition, our Birth to 5 region. So we wanted it to be from a legitimate site, legitimate information, and how do we ensure that? So we had to work through some things that way too, and having the families be the content developers, and then kind of running it through the chain to get you know, language approved, content approved. Like that happens every month, and I definitely give Stephan or Abby and Stephanie and Ashley's the team credit, because they're the ones that do a lot of the work with the families, getting that all together and finding the cute graphics and putting that all in. And but the parents are really leading it. So taking advantage of the expertise that's out there.
Of course, rookie move. I'm speaking on mute. Um, Allison, you added a piece on here on where you were recruited.
Yeah, so I was recruited at the local rec. Abby and Stephanie set up tables at different community events. And they had a sign up and they asked me to join. I originally started out in the Action Council, but that was during the day, and I'm an assistant. We're actually giving the ACT right now, so you might have noticed I've come in and out of video. So it was too much for me during the day. I was always getting pulled away. So the family council's been perfect for me. I do think when recruiting and trying to build collaboration, I think what's been really good is, I kind of live by people create the program. So you want to find the right people. And not to say that any parent voice is less than anyone else's, but I think it's helped to have different parents. Some are stay at home, some are childcare providers. One of them is a daycare provider. I'm in education and I have a lot of the community connection. So just kind of building your team to have different voices and different connections is, I think, really helpful.
I'm hearing some solid advice too for all of us here sitting at the table today, listening. Thinking about how we could move forward in uh, something similar. You had some really great advice here, really centering it on community voice and thinking about that collaboration and never giving up. And just really that intentionality, very thoughtful and reflection. I know, Abby, you were talking about just taking that time to reflect with Lois together and with Stephanie. Is there any other advice you would like to share out going forward for anybody else that might have plans uh, in doing a project like this?
I think Allison kind of segued us into it, and I having the unique privilege of coming into STARS that was already existing and then growing with the two councils and STARS is collaboration is key. And then like Allison just talked about, you can't have the same voices at the table. So ensuring that you have different perspectives, and then including family in the conversation. So this site and this bit.ly link would not be the same if we didn't have the family input, because how I might think of it and how Lois may think of it probably is really different than a family that's raising young children in a different part of the region, or they have a different background or have faced different barriers. So by having those conversations, we were able to do this. And then also that cross-sector piece, because we think early childhood systematically a lot of the time. So home visiting has their ways, childcare has their ways, preschools have their ways, and so on. But having all those voices, we were able to really look at, okay, how do we tie this together? But then also, we had a pastor on the family council, or the action council, I'm sorry, bring in the faith community, and there were resources that no one else at the table had thought about. So without having those cross-sector kind of relationships and collaboration opportunities like the councils and STARS, we wouldn't have really made it the same way. So I think that's the biggest advice I could give, is make sure you're including as many voices as you can, and then be open to the criticism. So if we don't have the feedback to make it better, we can't make it better and make it what our community really needs. Like I said, we're in the process of translating it to Spanish. We're in the process of adding in the community learning pages, and it'll probably continue to change. And that's how it should, to meet our community needs. Lois, I don't know, do you have any other thoughts?
Well, and we recognize also too that there's a really like the medical health piece missing. And so we've worked hard to try and get some buy-in at some level from some medical professionals, because again, like we cover 2,000 square miles. There's a lot of different medical systems in our region. And a lot of families go outside of our region for medical. So thinking about how we can make this information relevant to somebody in Rockford or DeKalb or Sterling is important because they're the ones that are going to be referring to our programs. So we also want to recognize that they provide essential services, therapies, and things that our children take advantage of. So we need to get some sort of information about that in this hub as well. So that's another big lift, I think, that's going to be coming.
But you're thinking about it, and I think that takes me into my next question is, as you're going forward in the hub, and I think I heard a couple pieces throughout, wanting to translate into Spanish. As you're going forward, what are those plans to add features, content, or expand your service area, if any?
Well, in year two of the councils, we work to continue the conversation of needs in our region through a mental and behavioral health needs assessment. So by creating O.W.L, it's been kind of a nice platform that we can almost brand, if you will, for the region. So the community talked about that of like, okay, if this is our centralized thing, how do we can expand that? So in the needs assessment for mental and behavioral health, we talked about a big need was connecting more with the healthcare community. We need to kind of connect the early childhood healthcare and parents. So that really has worked out conveniently as we're working on action steps for that mental and behavioral health piece of hearing from the healthcare community and then also sending this out to them because this is a resource that we hope could be used in doctors' offices or healthcare places. So that's part of that phase, along with some additional action steps of how do we connect better with them, like Lois just talked about. So we have other recommendations and needs that we established through that regional needs assessment that we can continue to work on. And we really have talked as kind of a collaboration and as councils of we really probably can keep kind of bouncing off of this idea and bringing it together as one thing. And then it's also kind of branded communication in our region as well. So that way we have this. If someone's goal is to go out and talk about parents as teachers program, but they want to know information also about childcare, well, hey, I have O.W.L and we're all a part of it. You can learn about the Child Care Resource and Referral Agency too.
Would anyone else like to answer as well to add to Abby? That's fantastic. I know that we have just a little bit of time left. I think that we have a couple questions in the chat that I want to make sure we circle back to. And if there's any other questions, please, or comments. I see we have some wonderful comments here too. I think, let's see. Jennifer had asked, what does recruitment look like for family councils? I know we touched on that. And I want to, the Birth of Five Illinois, you recruit yearly at one point, correct? It's not all year long. Is that correct? Or
We connect with the community all year round. So we're definitely connecting. The interest forms did just recently close on September 5th, but I think the recruitment question is a great question because we do want multiple voices. So I'm going to hand that one over to Stephanie to share how she's connected with families in the region.
Just like Abby said, it kind of goes on, throughout the whole entire year. I go to events, I go to the library, just kind of pop up wherever families are. Like Allison said, I met her at the rec center because they do a little open gym during the day for that preschool and under age group. And I set up a craft and just a little open time to talk to parents. So I do a lot of that. It's also our parents that are getting out in the community, and making sure that they're making those connections and kind of saying, hey, you'd be, really great to have on our council and, bring that parent voice, for us. So yeah, it's just being out there, being where families are at, and, getting those little tidbits, just wherever you are.
I loved,
Well,
Allison, how you were sharing that you share it even in your space and your connections as well. So you are able to continue to add to your council. That's wonderful all year long. Those that are interested in this, I hear that you have a consistent feedback loop. I love that you take good and bad so you can always make sure that you're strengthening this work. Thank you for that.
and
Let's
the
see.
other, can I
Go
add?
ahead.
So the other piece of that is because we're in a partnership with Birth to Five, um, we are open to anybody who wants to join us anytime. So we will take you whether you are an Action Council member or not. We don't even really make you attend the meetings because we send out minutes. Not minutes, but like notes of like a recap of the last meeting and flyers and all of that stuff. So even if you're not, like, Allison couldn't always attend, but she was getting the information. And we have a lot of people that say, um, no, I can't come to the meetings at all ever, but I do read the notes that come out, so I know what's going on. And otherwise, how would you'd miss so many people. And we had a number at one point, Abby, of how many people, it was like in the 90s. Um, our typical meetings are like 15, 20, but that's 90 other agencies or programs that are getting this information disseminated to them. And they know who I am, and I have no clue who they are half the time. But they know because of the notes they're getting and the information, or they come when they can, or share information that they can, and then we'll pass it on. So we do have a lot of voice even that way.
I don't remember the numbers, but it was a really cool chart to look at collaboration in many ways. So we had some that got content, some that were involved digitally, some that came to the meetings. And really, when you looked at those numbers, it was kind of like one size doesn't fit all with collaboration. You just kind of have to meet them where they're at, which was really nice.
Well, I see we have 2 minutes left, and I could continue to ask questions way longer than this, but I do appreciate your time and your expertise and to share this journey that you've all been on. In the chat, you will see contact information for your panelists today if anybody has any follow-up questions. And I just want to say, what a great way to share resources and really centering family voices is so apparent and intentional. And the reflective, thoughtful practices that you are putting in place are really exciting to hear. So thank you. Thank you so much. And I wish everybody a great afternoon. Thank you.